Hair loss is a progressive condition that affects the majority of men over time and up to 50% of women to varying degrees. Despite the wide range of treatments marketed today, including topical agents, oral medications, and device-based therapies, most of these options produce inconsistent results. For patients seeking a reliable and durable solution, hair transplantation remains the most effective intervention currently available. Today I'm going to review the two primary techniques used in hair transplantation, FUT and FUE, and explain the differences between them and why I believe FUT is a superior option. First, it's important to understand what a hair transplant actually involves. Hair transplantation does not create new hair follicles. Instead, it redistributes existing follicles from areas of the scalp that are resistant to hair loss, typically occipital and parietal regions, to areas of thinning or baldness. This principle is known as the donor dominance, meaning the transplanted hair retains its original growth characteristics regardless of its new location. There are two main harvesting techniques, FUT or Follicular Unit Transplantation and FUE or Follicular Unit Extraction. A linear strip of scalp is surgically excised from a donor area. This strip is then microscopically dissected into individual follicular units prior to implantation. In FUE, individual follicular units are harvested directly from the scalp using a punch device, one graft at a time. One of the most commonly discussed differences between these techniques is scarring. FUT results in a linear scar along the donor site, which is typically concealed by surrounding hair. FUE, on the other hand, results in multiple small circular scars distributed across the donor area. While these are less conspicuous individually, they can become noticeable, particularly in patients requiring a high number of grafts or those who prefer shorter hairstyles. There are three primary factors to consider when comparing these techniques. First, graft yield and efficiency. FUT generally allows for a higher number of grafts to be harvested per square centimeter. The strip method facilitates more precise dissection with reduced risk of transecting follicular units. Second, graft survival. Follicular units are living tissue, and their viability decreases the longer they are outside the body. Because FUT allows for faster harvesting and preparation, it may result in improved graft survival, particularly in larger sections. Third, cost and procedural complexity. FUE is more technically demanding and time-intensive, as each individual graft must be extracted. As a result, it is typically associated with higher procedural costs. That said, both FUT and FUE are valid and widely used techniques. FUE may be preferred in patients who require smaller sessions, have specific scarring concerns, or anticipate wearing very short hairstyles. However, I believe FUT is the better option. I've had hallway conversations with world-famous hair surgeons, and they all said personally they like FUT better. Like I said earlier, FUT provides much better yield and efficiency, and this translates to lower cost. FUT also has better graft survival. In FUT, I harvest the hair in one long strip across your occiput. This harvest is very fast. The strip is then handed immediately to the hair technicians who start to prepare each graft. While they're doing this, I am closing the harvest site. With FUE, you need to pluck out 2,000 grafts one at a time, all the time trying not to create a bad pattern that is visible. With FUT, it's one simple long strip, much quicker. Another factor to consider, I think most men would admit that if they had a choice, they would prefer to have a longer hairstyle. A longer hairstyle easily hides an FUT scar. Thus, the argument that FUE has a better scar than FUT is not really a strong one anymore. I've seen FUE pitched as the preferred technique to minimize scars so men can have a closed shave hairstyle. But I think the reason many men have a very short haircut or shave their head is because they're going bald already. Thanks to famous people like Michael Jordan, Bruce Willis, a clean shaven head is also good looking. Ultimately, the choice between FUT and FUE should not be based solely on marketing or general preference. It should be determined through a comprehensive evaluation that considers the extent of hair loss, donor hair density, the desired hairstyle, and long-term treatment goals. The key is to consult with a board-certified surgeon experienced in hair restoration in order to develop an appropriate treatment plan. If you found this information helpful, please like this video and subscribe to the channel. I'll continue to provide evidence-based insights to help you make informed decisions about your health and treatment options.